This is Heliox, where evidence meets empathy. Independent, moderated, timely, deep, gentle, clinical, global, and community conversations about things that matter. Breathe easy, we go deep and lightly surface the big ideas.
Welcome to the Deep Dive. Today we're tackling a really crucial subject. It might feel like old news to some, but, well, our sources paint a very different picture. We're diving into a comprehensive beginner's guide to the ongoing COVID-19 pandemic. This is the UK edition, just published in March 2025.
Very current, then.
Exactly. We've got a solid set of info here, all grounded in peer-reviewed scientific research. And the aim is clear. Explain why, and importantly, how we can minimize reinfection risk.
Right.
Our goal today, extract the most vital, maybe surprising insights, cut through the noise. We'll look at the current state, immunity, the virus's impact beyond that first week or so, and crucially, practical steps.
And what jumps out immediately in this guide is how it directly tackles that misconception, the idea that worrying about COVID now is some sort of, conspiracy theory.
Yeah.
The author is really clear. Nope, not the case. Everything here is based on solid, credible science. The real issue highlighted is this gap between UK government policy and the actual scientific understanding.
A
significant one. The guide suggests it's driven, or seems to be driven, by short-term economic thinking, which the author argues just isn't sustainable long-term. We'll probably circle back to that.
Okay, let's unpack where things stand now. One of the first problems this guide points out is the data. The official UK COVID data has major limitations now.
Right. Not because the virus vanished, but because how we track it has changed so much.
Exactly. Testing isn't really encouraged for most people. Free tests are scarce. And if you test positive privately, there's no way to officially report it.
And hospital screening is way down, too, even for people with symptoms.
Right. So how widespread is it really? It's hard to get a clear official picture.
It really is. But the guide points to clues suggesting it's still very widespread. First off, the WHO still calls it a pandemic. The global emergency phase is over, sure, but the pandemic itself, still ongoing according to them.
That's a big point. The WHO hasn't said it's over.
Not at all. Then you've got things like the Winter Coronavirus Infection Survey from December 2023. It estimated roughly 1 in 24 people in the UK were infected then.
1 in 24, that's a lot.
It's substantial, and not just a blip. The zero-week COVID study, before it stopped in September 23, suggested around 500,000 UK infections at any given time, even when transmission seemed low.
500,000.
Yeah.
Wow. So it's just constantly circulating.
Seems that way. And the guide looks abroad, too, at wastewater data. Scotland, the Netherlands, US, Canada, they all showed these ongoing infection peaks. It's not just a winter thing anymore.
Okay, and what about hospital numbers? Because that was always a key metric.
Well, this is striking. The guide states UK hospitalizations in 2022 were actually higher than in 2020 or 2021.
Higher? Really?
Yes. And for 2023, while the data is fuzzier due to less testing, the guide makes a reasonable argument that, without many protective measures, the numbers were likely just as high, maybe higher. So this it's over narrative. The available data doesn't really back it up.
Okay, this is where it gets really interesting. The guide breaks down why people might think it's over. We mentioned less testing. That's huge.
But it's not just fewer tests. It's the type of tests and how they're used.
You mean lateral flows?
Exactly. Lateral flows, or LFTs, they just aren't as sensitive as PCRs. They miss more infections. And that's made worse because the guidance often doesn't say swab your throat, or people test too early, before the viral load peaks a few days after symptoms start.
Right. Timing is key.
And beyond individual tests, stopping wastewater monitoring in England, Wales, and Northern Ireland, that was a big loss. It gave a broader picture, regardless of individual testing.
A community snapshot. Gone.
Pretty much. And finally, a technical point, but important, how they calculate excess deaths now by including the high death tolls from 2020-2023 in the baseline.
It raises the average expected deaths.
Correct, which can then make ongoing excess deaths look smaller or even disappear statistically. It masks the continuing impact.
So less testing, less sensitive testing, less community surveillance, and a shifted baseline for deaths. It all builds a potentially misleading picture.
That seems to be the guide's argument.
Okay, let's shift to a massive question. Immunity. If I've had it or I'm vaccinated, am I protected?
Yeah, this is critical. The short answer, based on the science, no, not really. Not against getting reinfected.
Ah.
Previous infection and vaccines, yes, they definitely help reduce the risk of severe outcomes, hospital, death. That's crucial. But protection against just catching it again, that fades, and quite quickly.
How quickly?
Studies show it wanes rapidly. The guide mentions documented cases of reinfection in as little as 16 days.
16 days. Wow. Barely recovered.
Exactly. And the virus keeps changing, right? New variants pop up.
And they dodge our old immunity.
That's a key feature. They're good at evading immunity from past infections or vaccines. And the vaccines themselves, while great against severe disease, their protection against infection is more limited and also fades fairly fast.
Plus, fewer people are getting boosters now.
That compounds it, yes. Reduced uptake is a factor. So you put all that together, this idea of herd immunity. It's just not achievable with this virus. The assumption that I've had it, I'm safe, it's incorrect.
That really shifts the thinking, doesn't it? It's
Right.
not a one-off. Okay, but what about the idea that even if you get it again, it's just mild now, like a cold or flu?
The guide is really firm on this. No, that comparison is inaccurate and potentially dangerous.
Why?
Because SARS-CoV-2, it's not just a respiratory bug. It gets in through the lungs, yes, but then it gets into the bloodstream. It causes systemic inflammation that's body-wide, and it attacks blood vessels.
Okay.
And this happens both in the initial acute illness and potentially in a chronic phase long after.
So even if the sniffles aren't bad, there's underlying stuff happening.
Precisely. Vaccines can make that acute bit feel milder, for sure, but they offer limited protection against the chronic illness, the potential organ damage down the line.
Right.
Increasingly, SARS-CoV-2 is looking more like viruses like, say, HIV, Epstein-Barr, even herpes or hepatitis C, where the initial illness might be mild, even flu-like, but the long-term harm is the major worry.
And this damage can happen even if you didn't feel sick. Asymptomatic cases.
Absolutely crucial point. Yes, both symptomatic and asymptomatic infections can cause this internal damage. Not feeling it doesn't mean it's not happening.
Which leads us straight into long COVID and maybe other long-term effects we don't even call long COVID yet. This sounds like a major focus of the guide.
It is, and it's deeply concerning. Studies suggest at least 10 to 20% of all infections result in ongoing, potentially disabling long COVID symptoms.
1 in 10, maybe 1 in 5.
Yes, but the risks go way beyond those classic long COVID symptoms like fatigue or brain fog. Even a mild infection significantly boosts your risk of cardiovascular problems for at least a year.
Like what?
Blood clots, heart attacks, strokes, pulmonary embolisms. The guide flags heart attack risk potentially increasing 3 to 8 times post-COVID. Compare that to smoking, usually cited as a 2 to 4 times risk increase.
Whoa, that's a huge increase, more than smoking.
That's what some data suggests. And it's not just the heart, the brain, too.
What happens to the brain?
MRI studies have found reduced overall brain size, loss of gray matter, even after mild COVID compared to controls, and significantly higher rates of cognitive impairment in healthcare workers post-infection.
That's worrying for everyone, but especially healthcare workers.
Absolutely. The list is long.
Right.
Increased risk of developing autoimmune diseases. One study found a 43% overall increased risk.
43%.
Links to newly acquired Alzheimer's and Parkinson's, possibly accelerating existing neurodegenerative conditions, too.
Good grief. It affects so many systems.
It does. Autonomic nervous system dysfunction that controls breathing, heart rate, digestion that can be disrupted. In men, reduced sperm count, motility issues, increased risk of erectile dysfunction.
Wow.
Immune dysfunction is a big one. Reduction in key immune cells, which might explain why we see increased severity of other infections like RSV or strep A, both during and after COVID for at least a year.
So getting COVID makes you more vulnerable to other bugs.
It appears so. And there's even research still emerging but worrying, suggesting COVID might trigger gene expression linked to cancer formation or speed up existing cancers?
That's terrifying. What about pregnancy in kids?
Yeah, this is really tough. Infections during pregnancy, linked to double the risk of a neurodevelopmental diagnosis in the baby at 1 year. Reduced lung volume, potential gut inflammation in the baby.
Ow.
Higher pregnancy mortality risk, too.
Oh, no.
For infants infected, poor psychomotor development. Even in kids who seem fine after, studies are finding subclinical, meaning hidden heart and lung damage. Increased risk of epilepsy, encephalitis, nerve disorders for at least 2 years post-infection.
For 2 years.
And even potential acceleration of biological aging at a cellular level. It's a lot.
It's almost overwhelming, the sheer range of potential issues.
And what's really insidious, the virus can persist. It can hang around in body tissues, brain, gut, elsewhere for months, maybe years, even if you don't have obvious long COVID
The
symptoms.
virus stays in you.
Evidence suggests it can. This wasn't totally unexpected, mind you. Similar long-term issues were seen after the first SARS outbreak in 2003. And crucially, the risk of long COVID and this multi-system damage seems to be cumulative.
Meaning each reinfection adds to the risk.
That's the concerning implication from current studies, yes. The guide stresses that the number of papers highlighting these long-term risks just keeps growing, right into 2025. This isn't old news, it's an unfolding public health issue.
Okay, if all this is happening, why isn't it more obvious? Why isn't it front page news every day?
That's a really fair question. The guide suggests part of it is that news reports often don't connect the dots back to COVID. You hear about rising heart problems or weird lingering colds, but COVID isn't always mentioned as a potential driver.
Or they blame something else, like lockdowns.
Exactly. Alternative, often unproven causes get suggested. Also, sometimes the clearest data comes from outside the UK, but it's reasonable to assume similar trends are happening here, even if they're less well documented officially.
So the clues are there, but maybe not being pieced together publicly.
It seems so. Like those reports since 2021 of people getting brutal colds, being sick for weeks, getting one thing after another.
Yeah.
That fits with COVID-induced immune dysfunction, but you rarely see that explanation offered.
Right.
We've also seen increases in infections, usually seen in immunocompromised people, TB, shingles, that fungal infection, Candida auris, rising since 2020.
And the excess deaths you mentioned earlier.
Yes, ongoing excess deaths from heart attacks, especially, quite worryingly, in the 25-44 age group. Some estimates put the excess death rate there between 23 and 34%.
That's a huge jump in young adults.
It is, backed up by reports of spikes in life insurance claims for people in their 40s and economically.
Yeah.
Germany apparently linked record sickness rates to recession. Here, the Health Foundation reports rising numbers off work due to ill health major economic impact.
Record long-term sickness absence rate.
A 30-year high in the UK, plus record NHS waiting lists, hospitals constantly declaring critical incidents. It's a system under immense strain.
And schools.
Higher chronic absenteeism in the UK and US compared to pre-2020. There's even speculation, maybe a stretch, but thought-provoking, linking rising violent crime to possible COVID brain damage. We see performers canceling shows constantly due to illness, often unnamed, possibly because insurance policies exclude COVID. Data from Singapore directly linked all their excess deaths in one period to recent COVID infections.
Oh, all of them.
According to their health minister, yes. A Spanish study found infected students less likely to get top grades. Doctors are anecdotally reporting more heart issues, strokes, clots, new autoimmune diseases, psychiatric symptoms post-COVID.
It's like a background hum of illness affecting everything.
And type 1 diabetes in kids and teens has shot up since the pandemic began. One study suggested a 6-fold higher risk after COVID, and the official number of people reporting long COVID in the UK keeps rising, including children. So the impacts are visible if you connect the dots.
It really does paint a different picture when you pull those threads together.
Yeah.
Okay, let's address a term we've heard a lot. Immunity debt. What's the guide's take on that?
Yes, immunity debt. The guide basically says it's a misguided idea, not really an established epidemiological concept.
Misguided how?
The theory is lockdowns reduced exposure to common bugs, so now our immune systems are weaker or naive, leading to more severe illness now. But immunity debt isn't really a scientific term. It kind of popped up in 2021.
So it's not like our immune system owes germs exposure.
Hey, no. The guide argues that the increased susceptibility we're seeing is much more likely due to COVID itself damaging or dysregulating immune systems, and makes some logical points too.
Like what?
Well, if immunity debt was real, wouldn't things like clean water and sanitation have given us a massive debt ages ago? Would astronauts have huge debts? What about kids born after lockdowns? Why are they getting severe illnesses too? The theory doesn't quite add up.
Good points.
And if there was a debt, surely it would have been paid back in 2022. But severe viral seasons continued. The consensus among experts cited is that COVID's impact on immunity is the likely culprit.
Not lack of exposure.
Right. And there's no evidence delaying infections makes them worse for young kids. Delaying can actually be better as their immune systems mature. The immune system isn't a muscle needing constant exercise. Frequent infections can actually make it malfunction.
That makes way more sense. Okay, let's nail down transmission. The guide is clear it's airborne, right?
Predominantly airborne, yes. Exhaled by breathing, talking. It hangs in the air like smoke, especially in poorly ventilated spaces. potentially for
Well,
hours.
breathing it in is the main risk.
Exactly. Inhalation is key. Hand washing is good hygiene, always, but there's little evidence it significantly stops COVID transmission. The focus needs to be on the air we breathe.
Which logically leads to masks. What's the verdict on their effectiveness?
Unequivocal, according to the study cited here, masks work. They reduce transmission both for the wearer and for others, at individual and community levels.
But which masks? Doesn't matter.
Hugely. Cloth masks, basic surgical masks, they offer some benefit, better than nothing. But respirator masks, like well-fitted FFP2s or FFP3s, are much more effective. Tighter weave, better seal, they filter out those tiny airborne particles far better.
Okay, FFP2 or FFP3 for best protection. So if they work so well, why aren't they still required, especially in hospitals or on transport?
That's the million-dollar question the guide asks. It highlights this major disconnect between the scientific evidence favoring masks and current public health policy, particularly in the UK.
They've mostly been dropped in hospitals, haven't they?
Most UK hospitals, yes. Mandates removed, regular staff testing stopped, staff returning while potentially still infectious. This is despite calls from healthcare workers, charities, scientists, vulnerable patients to keep protections.
It feels counterintuitive for hospitals.
It does. The guide points to ongoing WHO guidance. Mask up if you can't distance in poorly ventilated places and universally in healthcare settings during community transmission. WHO also advises 10 days isolation plus 3 symptom-free days.
So the global advice is still quite cautious.
Yes. And the fact that some hospitals do bring masks back temporarily during surges, well, it suggests they know they work, doesn't it? So why not maintain a baseline level of protection like we do for other infections?
What are the actual results of not having these protections in healthcare? Does the guide quantify that?
It does, and it's grim. At least 14,000 UK patient deaths attributed to hospital-acquired COVID, likely an underestimate. One London hospital study showed significant mortality from catching COVID in hospital.
So you go in for something else, catch COVID,
And have worse outcomes, longer stays, more complications, higher post-op mortality. There's even evidence that having COVID makes patients more susceptible to other hospital-acquired infections, probably due to immune suppression.
wow, that's a double whammy.
And data from Wales suggested about half of hospital COVID patients caught it while in hospital.
Half. That's staggering. So hospitals became major transmission sites.
That appears to be the case. Plus, staff getting sick means more absences, worsening shortages. A significant chunk of UK healthcare workers report long COVID symptoms.
Which impacts care delivery even more.
Exactly. The guide draws a historical parallel. The resistance to masks today echoes past resistance to things we now take for granted, like doctors washing hands or wearing gloves.
A sobering thought indeed. Okay, another key point. You can't just avoid people who look sick. Why not?
Because people can spread COVID before they show symptoms, or they might never show symptoms at all. Asymptomatic transmission is significant.
So someone could feel fine but still be infectious.
Absolutely. And complicating it further, many people actively hide being ill to avoid missing work, social stigma. One study found a large majority admitted concealing symptoms sometimes.
So relying on spotting coughs and sneezes just isn't enough.
Not even close.
Yeah.
It underlines the need for broad measures, not just individual vigilance about visible illness.
The guide also talks about unequal impacts, doesn't it? How the lack of data and protection hits some groups harder.
Yes, critically important. While the lack of transparency risks everyone's health, it disproportionately harms vulnerable and marginalized groups.
Who specifically?
Homeless people, higher reinfection risk, more underlying conditions. People of color, consistently higher rates of severe illness and death. LGBT individuals report higher rates of long COVID. People in low-income jobs, manual laborers, higher risk of death and long COVID. Disabled people, too.
And children. You mentioned guidance wasn't evidence-based.
Right. The UK's 3-day isolation guidance for kids, the guide says it's not supported by science. The paper sometimes cited actually found kids are most infectious in the first 5 days. It shows how weak guidance and data gaps worsen existing inequalities.
It really highlights systemic vulnerability. But amidst all this concerning information, the guide does mention people are pushing back, raising awareness.
Definitely. That's an important counterpoint. There are many individuals and groups globally working hard on this.
Like who?
Global networks like the World Health Network, the Jon Snow Project trying to get reliable info out, advocate for ending the pandemic threat, grassroots efforts too like the COVID-19 Safety Pledge or Clean Air Stars Group promoting safer indoor spaces.
Practical things businesses can do.
Yes. Local mask blocks providing free, high-quality masks. Campaigns like Protect the Heart of the Arts focusing on specific sectors. And the guide names many UK experts, charities, support groups who are persistently working on
So
this.
the voices are there, even if not always amplified.
Exactly. The guide acknowledges they often get drowned out by mainstream narratives that downplay the risks. But their dedication shows how serious this still is and why seeking out reliable info is vital.
Okay, let's bring it right down to the individual. What practical steps does the guide say we can take right now?
It provides a really clear list. The main focus, minimize infections, number one. Wear a well-fitted FFP2 or FFP3 mask indoors and in crowds. They offer far better protection.
Quality masks matter.
Absolutely. Test regularly, especially before gatherings or seeing vulnerable people. But remember, a negative test isn't foolproof. Be aware of the full range of symptoms. Muscle pains, sore throat, gut issues, rash, pink eye, not just the classic three. Move activities outdoors when you can, indoors. Ventilation is key. Open windows. Use HEPA filters. They physically remove virus particles from the air.
HEPA filters, got it. Anything else?
Nasal sprays and CPC mouthwashes are mentioned as potential extra layers, alongside masks and ventilation, though the evidence for them preventing infection alone is still limited.
So masks and air quality are the big ones for personal protection. What about wider actions?
Spreading awareness. Being visibly careful wearing a mask, talking about mitigations, sharing reliable info, signing petitions for things like masks in healthcare or on transport, amplifying those groups doing the hard advocacy work.
And if you do get infected,
Isolate. Minimum 10 days and until you test negative. Wear a high-quality mask if you absolutely have to go out. Tell your recent contacts. Rest is vital for recovery. Try to isolate within your home if possible. Ventilation, masks. Even consider isolating from pets, they can catch it too.
isolate from pets.
Okay. And stay vigilant for long COVID symptoms, which can appear weeks or months later. The bottom line message is about community protection. Every infection prevented makes a real difference.
Okay, let's try and summarize this deep dive. It feels like the main takeaway is this is definitely not over.
Not by a long shot.
Reinfections are common, immunity isn't really lasting against infection, and the long-term health consequences are serious, wide-ranging, impacting individuals, society, the economy.
And the underreporting, the data gaps, create this misleading sense of calm, while airborne spread means good masks are still absolutely critical.
It really challenges that dominant narrative, doesn't it?
Completely. It underscores how vital it is to stay informed from reliable sources and to take proactive steps for ourselves and our communities. The work being done by experts and advocates, even if quiet, highlights the ongoing seriousness.
It definitely leaves us with a lot to think about. Given everything we've heard, the long-term risks with every infection, the relaxation of public measures. What questions does this raise for you about navigating health and safety going forward? What's the role of individual action when mandates are gone?
It really does put the onus back on the individual, doesn't it? Balancing personal risk assessment with community well-being in the absence of strong public guidance. It's a complex space to navigate. Hopefully, this discussion has provided some solid information to help with those decisions.
We've covered a lot, but honestly, it feels like we've only skimmed the surface of what's in this guide and the research behind it. We really encourage everyone listening to explore the sources, check out the organizations mentioned, deepen your understanding, and think about what these insights mean for your own approach to health. Thanks for listening today. 4 recurring narratives underlie every episode: boundary dissolution, adaptive complexity, embodied knowledge, and quantum-like uncertainty. These aren't just philosophical musings, but frameworks for understanding our modern world. We hope you continue exploring our other podcasts, responding to the content, and checking out our related articles at helioxpodcast.substack.com.